Welcome to the NHA Phlebotomy Exam Study Guide, your path to NHA certification. Whether you're just starting your journey in phlebotomy, looking to sharpen your skills, or preparing for your NHA certification, this is the perfect place to start. In this video, we'll cover all the essentials of phlebotomy, including best practices, practical techniques, and exam tips to ensure you're fully prepared. After each chapter, we've included a Q&A section to help solidify your understanding. For the ultimate prep experience, check the description to access the Audible version, the free exam prep guide, or the Amazon link for the book. Don't forget to like and subscribe for more exam resources and updates. Now, here's your instructor to guide you on this path to certification.
Number 1. What is the optimal temperature for transporting most blood specimens? A. Room temperature. B. 0 to 4 degrees centigrade. C. Minus 20 degrees centigrade. Or D. 37 degrees centigrade. The answer is B. 0 to 4 degrees centigrade. Number 2. Which of the following additives is commonly used to prevent clotting in a blood specimen? A. Heparin. B. EDTA, C. Sodium citrate, or D. All of the above. The answer is D. All of the above. Number 3. What is the consequence of overfilling a blood collection tube? A. Hemolysis. B. Dilution of the specimen. C. Altered test results, or D. None of the above. The answer is B. Dilution of the specimen. Number 4. Which department typically processes blood cultures? A. Hematology. B. Chemistry. C. Microbiology. Or D. Immunology. The answer is C. Immunology. Number 5. What is the importance of properly labeling a blood specimen immediately after collection? A. Prevents loss of the specimen. B. Ensures accuracy and reliability of test results. C. Facilitates easy tracking. Or D. All of the above. The answer is D. All of the above. Number 6. Which tube should be drawn first in the order of draw? A. EDTA. B. Sodium citrate. C. SST. Or D. Heparin. The answer is B. Sodium citrate. Number 7. What is the most critical error a phlebotomist can make? A. Mislabeling specimens. B. Incomplete filling of tubes. C. Incorrect order of draw. Or D. Not following safety protocols. The answer is A. Mislabeling of specimens. Number 8. Which antiseptic is commonly used for blood cultures? A. Alcohol. B. Chlorhexidine. C. Iodine. Or D. Hydrogen peroxide. The answer is B. Chlorhexidine. Number 9. What is the proper angle of insertion for a needle during venipuncture? A. 15 to 30 degrees. B. 30 to 45 degrees. C. 45 to 60 degrees. Or D. 60 to 75 degrees. The answer is A. 15 to 30 degrees. Number 10. How long should a tourniquet remain on the arm during venipuncture? A. 1 minute. B. 2 minutes. 3 minutes. Or D. 5 minutes. The answer is A. 1 minute. Number 11. What does the term hemolysis refer to in phlebotomy? A. Clotting of blood. B. Destruction of red blood cells. C. Infection of the blood. Or D. Coagulation of the blood. The answer is B. Destruction of red blood cells. Number 12. Which of the following tubes is used for coagulation studies? A. Light top tube. B. Red top tube. C. Green top tube. Or D. Lavender top tube. The answer is A. Light blue top tube. Number 14. What is the primary reason for mixing the blood tubes gently after collection? A. To prevent hemolysis. B. To ensure proper ratio of blood to additive. C. To prevent clotting. Or D. All of the above. The answer is D. All of the above. Number 15. What information is essential to include when labeling a blood specimen? A. Patient's full name. B. Date and time of collection. C. Phlebotomist's initials. Or D. All of the above. The answer is D. All of the above. Number 16. What is the first step in processing blood specimens after collection? A. Centrifugation. B. Aliquoting. C. Freezing. Or D. Logging into the LIS. The answer is D. Logging into the LIS. Number 17. In which tube does fibrinolysis take place during the processing of blood specimens? A. SST. B. Heparin. C. EDTA. Or D. Sodium citrate. The answer is A. SST. Number 18. What does the gauge of a needle indicate? A. Length. B. Sharpness. C. Diameter. Or D. Compatibility with tube holders. The answer is C. Diameter. Number 19. Which blood specimen requires protection from light during transportation? A. Glucose. B. Bilirubin. C. Potassium. Or D. Cholesterol. The answer is B. Bilirubin. Number 20. What does the presence of bubbles in a blood specimen indicate? A. Hemolysis. B. Air contamination. C. Inadequate filling of the tube. Or D. Infection in the specimen. The answer is B. Air contamination. Number 21. Which of the following is a common cause of specimen rejection? A. Hemolysis. B. Incorrect labeling. C. Prolonged tourniquet application. Or D. Both A and B. The answer is D. Both A and B. Number 22. Which of the following tests requires an aseptic technique during blood collection? A. CBC. B. Blood culture. C. Lipid panel. Or D. Hemoglobin. The answer is B. Blood culture. Number 23. Which department is responsible for blood typing and cross-matching? A. Hematology. B. Immunohematology. C. Chemistry. Or D. Microbiology. The answer is B. Immunohematology. Number 24. Which of the following is a suitable site for capillary puncture? A. Thumb. B. Index finger. C. Ring finger. Or D. Middle finger. The answer is C. Ring finger. Number 25. What does centrifugation of a blood specimen achieve? A. Mixing of additives. B. Separation of blood components. C. Homogenization of blood. Or D. Coagulation enhancement. The answer is B. Separation of blood components. Number 26. Which of the following may result in patient injury during venipuncture? A. Using a large gauge needle. B. Anchoring the vein firmly. C. Performing a blind stick. Or D. Applying a tourniquet too tightly. The answer is C. Performing a blind stick. Number 27. Which color-coded tube is typically used for liver function tests? A. Red. B. Green. C. Lavender. Or D. Yellow. The answer is B. Green. Number 28. When should a phlebotomist perform hand hygiene? A. Before patient contact. B. After removing gloves. C. After handling specimens. Or D. All of the above. The answer is D. All of the above. Number 29. What must a phlebotomist do if a patient refuses a blood draw? A. Proceed with the draw. B. Persuade the patient. C. Inform the healthcare provider. Or D. Use force to ensure blood sample collection. The answer is C. Inform the healthcare provider. Number 30. How should blood specimens be transported to the laboratory? A. In a biohazard bag. B. In a regular plastic bag. C. Uncovered on a tray. Or D. In a sealed envelope. The answer is A. In a biohazard bag. Number 31. Which tube is typically used for complete blood count, CBC? A. Red top. B. Lavender top. C. Green top. Or D. Gray top. The answer is B. Lavender top. Number 32. Which of the following is an essential characteristic of a professional phlebotomist? A. Technical competence. B. Communication skills. C. Empathy. Or D. All of the above. The answer is D. All of the above. Number 33. What could lead to erroneous blood test results? A. Prolonged fasting. B. Dehydration. C. Exercise. Or D. All of the above. The answer is D. All of the above. Number 34. How long should pressure be applied to the venipuncture site after needle withdrawal? A. Until bleeding stops. B. For at least 2 minutes. C. For 30 seconds. Or D. For 1 minute. The answer is A. Until bleeding stops. Number 35. Which of the following precautions helps prevent needle stick injuries? A. Recap the needles after use. B. Dispose of needles in a sharps container. C. Bend the needles before disposal. Or D. Remove the needles from the holder before disposal. The answer is B. Dispose of needles in a sharps container. Number 36. What is the correct order of draw in a multi-tube blood collection? A. SST, EDTA, heparin. B. EDTA, heparin, SST. C. Heparin, SST, EDTA. Or D. Sodium citrate, SST, EDTA. The answer is D. Sodium citrate, SST, EDTA. Number 37. Which department in the laboratory typically handles immunology testing? A. Microbiology. B. Hematology. C. Serology. Or D. Biochemistry. The answer is C. Serology. Number 38. What does the term anticoagulant refer to in phlebotomy? A. A substance that prevents infection. B. A substance that prevents clotting. C. A substance that enhances clotting. Or D. A substance that enhances hemolysis. The answer is B. A substance that prevents clotting. Number 39. What is the primary function of a tourniquet in venipuncture? A. To sterilize the site. B. To prevent backflow of blood. C. To make the veins more prominent. Or D. To numb the site. The answer is C. To make the veins more prominent. Number 40. What is the crucial step to ensure the accuracy of a glucose test? A. Fasting for 24 hours prior. B. Using a gray top tube. C. Vigorous mixing of the sample. Or D. Immediate transportation to the lab. The answer is B. Using a gray top tube. Number 41. What is the first thing a phlebotomist should do in case of a needle stick injury? A. Wash the area with soap and water. B. Apply antiseptic ointment. C. Contact the supervisor immediately. D. Cover the area with a bandage. The answer is A. Wash the area with soap and water. Number 42. Which action is most likely to cause hemolysis of a blood sample? A. using a small gauge needle. B. Vigorous mixing of the tube. C. Storing the sample at room temperature. Or D. Using a tourniquet for an extended period. The answer is B. Vigorous mixing of the tube. Number 43. Which of the following tests assesses kidney function? A. BUN and creatinine. B. CBC. C. PT/INR. Or D. Liver enzymes. The answer is A. BUN and creatinine. Number 44. When is the use of a winged infusion set, a butterfly needle, most appropriate? A. For obese patients. B. For arterial blood gases. C. For pediatric patients. Or D. For routine venipuncture. The answer is C. For pediatric patients. Number 45. What type of consent is obtained in emergency situations where the patient is unconscious and no legal guardian is available? A. Informed consent. B. Implied consent. C. Express consent. Or D. Written consent. The answer is B. Implied consent. Number 46. Which color tube is commonly used for lead analysis? A. Tan. B. Gray. C. Red. Or D. Green. The answer is A. Tan. Number 47. What is the recommended depth for heel puncture in newborns? A. 1.0 millimeters. B. 2.0 millimeters. C. 3.0 millimeters. Or D. 4.0 millimeters. The answer is B. 2.0 millimeters. Number 48. What is the recommended procedure when a patient has a syncope episode during venipuncture? A. Continue with the procedure. B. Remove the needle and apply pressure to the site. C. Lay the patient flat and elevate the legs. D. Both B and C. Number 49. What is the main risk factor for phlebotomists in acquiring a blood-borne pathogen? A. Aerosol exposure. B. Needle stick injuries. C. Ingestion of contaminated blood. Or D. Handling blood specimens without gloves. The answer is B. Needle stick injuries. Number 50. Which of the following is a violation of patient confidentiality? A. Discussing patient results in the elevator. B. Sharing patient information on a need-to-know basis. C. Verifying the patient identity before sharing test results. D. Keeping patient records locked when not in use. The answer is A. Discussing a patient's results in the elevator. Number 51. Which of the following tubes is primarily used for molecular and DNA testing? A. Yellow top tube with ACD. B. Royal blue top tube. C. Black top tube. Or D. Orange top tube. The answer is A. Yellow top tube with ACD. Number 52. How long should a patient fast before a cholesterol test? A. 2 to 4 hours. B. 8 to 12 hours. C. 12 to 14 hours. Or D. No fasting required. The answer is B. 8 to 12 hours. Number 53. Which vein is most commonly used for venipuncture? A. Basilic vein. B. Cephalic vein. C. Medium cubital vein. Or D. Radial vein. The answer is C. Cephalic vein. Number 54. What information should be provided to the laboratory when a blood specimen is collected from an IV line? A. Time of collection. B. Site of collection. C. That it was collected from an IV line. D. All of the above. The answer is D. All of the above. Number 55. Which of the following samples should be protected from light exposure immediately after collection? A. Sodium. B. Ammonia. C. Bilirubin. D. Alkaline phosphatase. The answer is C. Bilirubin. Number 56. When is the use of a heel stick most appropriate for blood collection? A. Adolescents. B. Adults. C. Newborns and infants. Or D. Elderly patients. The answer is C. Newborns and infants. 57. What tube is used for ethanol/alcohol testing? A. Gray top. B. Red top. C. Green top. Or D. Blue top. The answer is A. Gray top. Number 58. What is the maximum number of times you should attempt a venipuncture on a single patient? A. 1. B. 2. C. 3. Or D. 4. The answer is B. 2. Number 59. What does the term postprandial refer to? A. Before a meal. B. After a meal. C. During a meal. Or D. Fasting state. The answer is B. After a meal. Number 60. What should you do if you suspect that the patient has a hematoma during blood collection? A. Continue the collection. B. Remove the tourniquet and needle immediately. C. Try another site. Or D. Apply a warm compress. The answer is B. Remove the tourniquet and needle immediately. Number 61. Which of the following is a common complication in phlebotomy? A. Nerve damage. B. Infection. C. Hematoma. Or D. All of the above. The answer is D. All of the above. Number 62. Which department would process a CBC, complete blood count? A. Chemistry. B. Hematology. C. Microbiology. Or D. Blood bank. The answer is B. Hematology. Number 63. What type of consent is necessary for a blood transfusion? A. Implied consent. B. Verbal consent. C. Informed written consent. Or D. General consent. The answer is C. Informed written consent. Number 64. Which sample requires a chain of custody procedure? A. Glucose. B. Drug screening. C. CBC. Or D. Electrolytes. The answer is B. Drug screening. Number 65. What type of precautions should be taken when handling blood specimens? A. Universal precautions. B. No precautions necessary. C. Respiratory precautions. Or D. Isolation precautions. The answer is A. Universal precautions. Number 66. What information should be included in a blood specimen's label? A. Patient's name and ID number. B. Date and time of collection. C. Phlebotomist's initials. Or D. All of the above. The answer is D. All of the above. Number 67. Which type of muscle should not be used for an IM, intramuscular injection? A. Deltoid. B. Gluteal. C. Bicep. Or D. Quadricep. The answer is C. Bicep. Number 68. For which test is the patient required to consume a special diet 72 hours prior to specimen collection? A. Fecal occult blood test. B. Glucose tolerance test. C. Blood culture. Or D. Creatinine clearance. The answer is D. Creatinine clearance. Number 69. Which of the following veins are best suited for venipuncture in the elderly? A. Dorsal hand veins. B. Median cubital veins. C. Wrist veins. Or D. Ankle veins. The answer is A. Dorsal hand veins. Number 70. Which condition can result from repeated venipuncture of the same vein? A. Sclerosed veins. B. Hematoma. C. Phlebitis. D. Thrombosis. The answer is A. Sclerosed veins. Number 71. Which of the following actions is necessary after collecting a blood culture specimen? A. Chill immediately. B. Protect from light, C. Incubate at body temperature, or D. Centrifuge immediately. The answer is C. Incubate at body temperature. Number 72. How should you handle a lipemic serum sample? A. Centrifuge for a longer time. B. Warm up before analysis. C. Analyze immediately. Or D. Store at room temperature. The answer is B. Warm up before analysis. Number 73. Which regulatory agency establishes guidelines for specimen handling and processing? A. FDA, B. CLIA, C. OSHA, or D. CAP? The answer is B. CLIA. Number 74. Which of the following laboratory tests evaluates the intrinsic pathway of coagulation? A. PT, B. APTT, C. TT, or D. Fibrinogen? The answer is B. APTT. Number 75. What is the role of EDTA in a blood sample? A. Clot activation, B. Glycolysis prevention, C. Clot prevention, or D. Hemolysis prevention? The answer is C. Clot prevention. Number 76. Which of the following is the best method to mix a blood sample in a collection tube? A. Shaking vigorously, B. Inverting gently 5 to 10 times, C. Rotating on a tube roller, or D. Stirring with a stirrer? The answer is B. Inverting gently 5 to 10 times. Number 77. Which of the following is a point-of-care test? A. Blood culture, B. CBC, C. Glucose finger stick, or D. Coagulation panel? The answer is C. Glucose finger stick. Number 78. What is the order of draw for capillary specimens? A. EDTA tubes, other additive tubes, serum tubes. B. Serum tubes, EDTA tubes, other additive tubes. C. Other additive tubes, EDTA tubes, serum tubes. Or D. Serum tubes, other additive tubes, EDTA tubes. The answer is A. EDTA tubes, other additive tubes, and serum tubes. Number 79. Which additive is used in a light blue top tube? A. Heparin, B. EDTA, C. Citrate, or D. Oxalate? The answer is C. Citrate. Number 80. Which of the following is a requirement for performing arterial puncture? A. Special certification, B. No extra requirements, C. Permission from a doctor, D. 2 years of experience? The answer is A. Special certification. Number 81. Which of the following is an acceptable antiseptic for routine venipuncture? A. Iodine, B. Alcohol, C. Hydrogen peroxide, or D. Benzalkonium chloride? The answer is B. Alcohol. Number 82. Which of the following tubes can be used for trace element analysis? A. Royal blue top tube, B. Red top tube, C. Green top tube, or D. Yellow top tube? The answer is A. Royal blue top tube. Number 83. In which of the following conditions should a phlebotomist avoid performing venipuncture in the patient's arm? A. Presence of a scar, B. Presence of a hematoma, C. Presence of a tattoo, or D. Presence of an IV? The answer is D. Presence of an IV. Number 84. Which of the following is the appropriate angle of needle insertion during venipuncture? A. 15 to 30 degrees, B. 30 to 45 degrees, C. 45 to 60 degrees, or D. 60 to 75 degrees? The answer is A. 15 to 30 degrees. Number 85. Which tube is used to collect blood for a CBC, complete blood count? A. Red top tube. B. Light blue top tube. C. Lavender top tube. Or D. Green top tube? The answer is C. Lavender top tube. Number 86. Which organization sets standards for phlebotomy procedures? A. FDA. B. CLSI. C. OSHA. Or D. AABB? The answer is B. CLSI. Number 87. Which of the following is a proper technique for mixing blood and additive in a collection tube? A. Shaking vigorously. B. Gentle inversion. C. Stirring with a rod. Or D. Tapping on a hard surface? The answer is B. Gentle inversion. Number 88. What is the most critical error a phlebotomist can make? A. Mislabeling a specimen. B. Failing to invert the tube. C. Choosing the wrong vein. Or D. Using an expired tube? The answer is A. Mislabeling a specimen. Number 89. Which of the following tubes is used for blood bank testing? A. Pink top. B. Blue top. C. Red top. Or D. Gray top? The answer is A. Pink top. Number 90. What is the best way to prevent infection during phlebotomy procedures? A. Wearing gloves. B. Hand washing. C. Using a tourniquet. Or D. Applying antiseptics properly? The answer is B. Hand washing. Number 91. Which vein lies close to the brachial artery? A. Cephalic vein. B. Basilic vein. C. Median cubital vein. Or D. Brachial vein? The answer is B. Basilic vein. Number 92. What is the most appropriate action when a patient refuses a blood draw? A. Insist and continue with the procedure. B. Inform the patient about the importance of the test. C. Report to the nurse or physician immediately. Or D. Convince the patient to agree? The answer is C. Report to the nurse or physician immediately. Number 93. What additive is used in the tube for a PT/INR test? The answer is A. EDTA. B. Sodium citrate. C. Heparin. Or D. None? The answer is B. Sodium citrate. Number 94. When should a phlebotomist release the tourniquet during venipuncture? A. Before needle insertion. B. After filling the first tube. C. Within 1 minute. Or D. Before withdrawing the needle? The answer is C. Within 1 minute. Number 95. Which of the following specimens should be chilled immediately after collection? A. CBC. B. PT/INR. C. Ammonia. Or D. Serum electrolytes? The answer is C. Ammonia. Number 96. What is the proper sequence of specimen collection in a multi-draw? A. Blood cultures, coagulation, chemistry, hematology. B. Hematology, chemistry, coagulation, blood cultures. C. Coagulation, blood cultures, chemistry, hematology. Or D. Chemistry, hematology, blood cultures, coagulation? The answer is A. Blood cultures, coagulation, chemistry, hematology. Number 97. What information is required on a blood specimen label? A. Patient name and date of birth. B. Date and time of collection. C. Phlebotomist's initials. Or D. All of the above? The answer is D. All of the above. Number 98. What does the term hemolysis refer to? A. Clotting of blood. B. Destruction of red blood cells. C. Infection in the blood. Or D. Thickening of the blood? The answer is B. Destruction of red blood cells. Number 99. Which test requires a patient to fast for 8 to 12 hours before collection? A. CBC, B. Lipid panel, C. Basic metabolic panel, or D. Blood culture? The answer is B. Lipid panel. Number 100. Which of the following should not be used to clean up a blood spill? A. Bleach, B. Alcohol, C. Hydrogen peroxide, or D. Disinfectant wipes? The answer is B. Alcohol. Number 101. What is the maximum acceptable depth for a heel stick on a premature infant? A. 0.65 millimeters, B. 1.0 millimeters, C. 2.0 millimeters, D. 2.4 millimeters? The answer is A. 0.65 millimeters. Number 102. Which tube should be drawn first in a capillary collection? A. EDTA, B. heparin, C. Serum separator, or D. Sodium citrate? The answer is A. EDTA. Number 103. What should be done if a patient appears to be having a seizure during a blood draw? A. Continue drawing blood, B. Secure the patient's arm and remove the needle, C. Hold the patient down to prevent movement, D. Call for help and wait for the seizure to stop? The answer is B. Secure the patient's arm and remove the needle. Number 104. What action should be taken if a collected blood specimen is hemolyzed? A. Use it for testing anyway. B. Centrifuge it longer. C. Discard and redraw the specimen. Or D. Place it on ice immediately? The answer is C. Discard and redraw the specimen. Number 105. Which of the following statements about glucose testing is true? A. It can be performed at any time of the day. B. It requires a 12-hour fasting period. C. It should be collected in a red top tube. Or D. The specimen should be exposed to light? The answer is B. It requires a 12-hour fasting period. Number 106. Which vein is typically the easiest to palpate on an obese patient? A. Median cubital vein, B. Cephalic vein, C. Basilic vein, or D. Dorsal hand veins? The answer is B. Cephalic vein. Number 107. What should a phlebotomist do if the blood flow into the tube stops during a venipuncture? A. Adjust the needle's position. B. Remove the needle and try another site. C. Push the needle further into the vein. Or D. Try to locate another vein with the needle still inserted. The answer is A. Adjust the needle's position. Number 108. In what order should tubes be filled during a dermal puncture? A. Lavender top tube, green top tube, serum separator. B. Serum separator, lavender top, green top. C. Green top, serum separator, lavender top. Or D. Lavender top, serum separator, green top. The answer is D. Lavender top, serum separator, green top. Number 109. What complication can occur if a tourniquet is left on for too long? A. Hemolysis, B. Hemoconcentration, C. Hematoma, or D. Infection? The answer is B. Hemoconcentration. Number 110. Which of the following is a sign of inflammation? A. Redness, B. Coldness, C. Pallor, D. Cyanosis? The answer is A. Redness. Number 111. Which of the following is an anticoagulant found in a purple top tube? A. Heparin, B. EDTA, C. Sodium citrate, or D. No anticoagulant? The answer is B. EDTA. 112. What is the proper site for performing an infant heel stick? A. The arch of the heel, B. The center of the heel, C. The medial or lateral plantar surface, or D. Any accessible part of the heel? The answer is C, the medial or lateral plantar surface. Number 113. What is the first step in the blood drawing process? A. Applying a tourniquet. B. Identifying the patient. C. Choosing a vein. Or D. Cleaning the site. The answer is B. Identifying the patient. Number 114. Which of the following tubes would be used for a liver function test? A. Green top tube. B. Gold top tube. C. Lavender top tube. Or D. Gray top tube. The answer is B. Gold top tube. Number 115. What is the most important factor in preventing specimen contamination? A. Wearing gloves. B. Using sterile equipment. C. Proper patient identification. Or D. Proper site preparation. The answer is D. Proper site preparation. Number 116. Which of the following is the most common complication of phlebotomy? A. Infection. B. Hematoma. C. Nerve damage. D. Fainting. The answer is B. Hematoma. Number 117. Which tube should be drawn first when collecting a blood culture? A. Aerobic bottle. B. Anaerobic bottle. C. Either, it doesn't matter. Or D. A single bottle that combines both. The answer is A. Aerobic bottle. Number 118. How should needles be disposed of after use? A. Recap and place in a regular trash bin. B. Place directly in a sharps container without recapping. C. Recap and place in a biohazard bag. Or D. Decontaminate and reuse. The answer is B. Place directly in a sharps container without recapping. Number 119. How many times can a needle be used before disposal? A. Once. B. Twice. C. 3 times. Or D. As many times as needed if decontaminated. The answer is A. Once. Number 120. Which of the following tests is sensitive to light? A. Sodium. B. Bilirubin. C. Potassium. Or D. Hemoglobin. The answer is B. Bilirubin.